Scene 4. His problems were not dramatic, which made them easier to miss. This boy did not have hallucinations. He did not have delusions. And he did not have obvious confusion or disorganized consciousness. But that does not mean he had no neuropsychiatric problems. In fact, his presentation was exactly the kind that is easiest to overlook in real life and most exhausting for families and schools. Mild intellectual disability, developmental delay, hyperactivity, and an overall pattern of dysregulated behavior and functioning. These problems do not look dramatic, and because they do not, they are often explained away with familiar phrases. He's just a little slow. He's just hard to manage. His attention is just poor. He's just more temperamental. But from the perspective of metabolic disease, these are not a handful of separate minor problems. They are more like this. The brain has been operating for years without enough of a key raw material. And as a result, cognition, behavior, attention, and electrical brain activity have all begun to drift out of balance together. Scene 5. The sister's story brought behavioral and emotional problems to the front. The brother's case was shaped more by hyperactivity, learning difficulties, and absent seizures. The sister, however, made another side of the disorder much easier to see: behavioral problems and emotional problems. In early childhood, she did not seem abnormal from the start. The pregnancy had been uneventful. The birth had also been uneventful. At birth, her head circumference, weight, and length were all normal. Her early developmental milestones were normal as well. But after age 4, developmental delay began to emerge gradually. Later, she too developed absence epilepsy, and she developed it even earlier than her brother did. Her seizures began at age 5. She was treated with anti-epileptic medication, but even so, the absent seizures continued to occur every day. And what made her case even more exhausting was not just the seizures themselves. The report specifically notes marked behavioral problems, along with mood swings and emotional disturbance. That means she was not simply a girl with